Thank you for coming to this side event hosted by myself. My name is Berit Stølen. I'm Kylie Shaw, as you all met yesterday and today from WHO. I'm starting this side event with giving a presentation about the Norwegian assistive technology system. And Kylie will carry on after some Q&A, and she will tell us about the tools that you have for assistive technology. I think I give the presentation, and then we can have the questions afterwards, because sometimes I answer the questions during my presentation. Yes. In Norway, we got a uniform national system for assistive technology since 1995. You can start with a slide. The aim has been to ensure that users are giving the same level of services and are met by professionals with the same expertise, regardless of where they live in the country. Today we have 14 assistive technology centers, one in each county. Based on individual rights, the provision of assistive technology is covered by the Act on Social Security in Norway. The devices are funded by the National Insurance Scheme and free of charge for the user. Assistive technology is provided to persons whose functional capacity is permanently impaired due to illness or injury. In addition, the assistive products must be both necessary and appropriate with regard to improving the user's ability in performing activities and to participate in daily life. Yes, please. Next. The policy aims at providing the most appropriate, yet the cheapest solution free of charge for the user. The assistive technology centers own the assistive products, and the user lend the equipment for as long as they need it, before it is returned to us after use, almost like a library. The center has an overreaching and coordinating responsible for assistive products. The assistive technology centers have trained personnel with expert knowledge about assistive technology and adaptation. They give guidance to the local authorities and other stakeholders in the county. The local personnel can ask for help from the assistive technology centers if the local network does not have sufficient expertise. We are responsible for educating the municipalities in the system, products and changes in regulation. There are few accredited postgraduate education programs within assistive technology in Norway. The assistive technology centers organize and run courses according to a yearly program for the municipality service and other partners. Many of the courses are now made available as digital solutions on the internet. Some universities are giving the occupational therapy students and physiotherapists some lessons in assistive technology, but many trained personnel doesn't have these skills when they are starting working. So this is the responsibility of the Assistive Technology Center. Next, please. The following professionals are often represented at each assistive technology center. We have audiologists, physiotherapists, occupational therapists, and technicians. We have sign language interpreters at our assistive technology centers, optometrists, and legal decision makers to handle the application forms. We work interdisciplinary to find the best solution. Next, please. So under the same roof, working interdisciplinary and cooperating with the municipality, the local authorities, We are able to make legal decisions on the application form. We perform assessment. We provide the most suitable products to the user. We keep track on delivery and transport of all the goods. We adjust and fit the product individually. We offer repair and spare parts. We refurbish products, and therefore we store both new and refurbished products in our stock. And at least we offer guidance to our stakeholders. So this makes us what we also always is called a one-stop shop. And since we are organized by counties, we operate reasonably close to the user. Next, please. The local authorities, they have the fundamental responsibility for the healthcare, social and rehabilitation services for their inhabitants. And this includes provision of assistive technology. Trained personnel, usually occupational therapists or physiotherapists, are responsible for identifying and assessing the user's needs, recommending solution, and assist with application for assistive technology, as well as following up the user's situation in daily life. The municipality has local technicians who can perform repairs and maintenance of the products in the user's home. And we think user involvement during the whole process is very crucial. Next, please. The professional at municipality and county level, they complete each other. With the generalist at the municipal level, they handle the frequent and simple cases, and the specialist at the county level, at the assistive technology centers, we can offer guidance where the solution is more complicated and rarer. Next. The assistive technology process always starts with identifying the problem. For instance, vision or hearing impairment. Then a survey is made. This includes the function of the person, considering the environment and human resources around the person. Then a goal should be set. The international classification of function can be used. Is the goal on function or on participation level? Then you agree on a solution together with the user. Assistive technology is not always the answer, but can be one part of the solution. Maybe the solution is altering the environment or human resources. For instance, for a blind child to be able to walk to school, the solution can be an assistive product like a white cane. It can be human resources like friends or an assistant. It can be adaptation in the environment, like a red light making a sound, or guidelines on the payment. When the solution is chosen, you will have to do follow-ups. It is a common problem that assistive product does not fulfill the user's need because of lack of training, or perhaps it needs individual alterations. This is a responsibility of the municipality, the local authorities. This is a crucial step in the process to see to that the product is used and appropriate. After a while, we do an evaluation. Have the goals been achieved? If not, why? We will then have to start at step one, identifying the problem and making a new survey of the user situation. Maybe we have to adjust the goal or the solution. Next, please. We believe in getting the best solution through teamwork. The professional at the Assistive Technology Center, we work closely in cooperation with the teachers, the assistant, the health service in the municipality, the technical personnel, and of course the family, and putting the user always in the middle of the process. Next, please. Coming over to procurement. For purchasing the assistive products, we have procurement framework agreement for the whole country. The tender process is handled by a special central unit for purchase. Professionals from the Assistive Technology Center, they participate in the tender process to make sure that the user's need is fulfilled by the products. So it's not just economic professionals. We have a national information communication technology system for registering of all the costs and the distribution of assistive device and services. So we have good data. Before we start the tender process, we always look at the statistics from this system to find out what we have the need for, both in assistive products and which services we need. The type of services demanded varies from different types of equipment and can include trials, customization, refurbishment, repairs, and systematic follow-up controls for electromedical devices. It takes approximately 12 to 18 months to complete an agreement from the start, where we assess the need of the users, to the agreement is signed. A crucial part of the process is the physical evaluation of the products, where we rate quality and price. We almost always rate quality up to 60% of the total score and price up to 40% to guarantee that we get functional, high-quality product which lasts long and are suitable for refurbishment and adjustments along the way. We also include provision of spare parts in the agreement. To ensure refurbishment and reuse, the dealer must undertake to deliver spare parts for 5 more years after the agreement has expired. The procurement agreement lasts for 2 years and can be prolongated for 2 more years. To follow the Public Procurement Act, we must always consider the product included in the procurement agreement first. If this product does not meet the need of the user, we will have to apply for an acceptation. Next, please. An important part of the Norwegian assistive technology system is refurbishment. Since the users are just lending the products, we have the responsibility to reuse as much of the products as we possibly can. This means that we also distribute second-hand products to the users. And as I mentioned last year, the Assistive Technology Center, where I work, we refurbished assistive device for 6 million euros, and our operating budget was 5 million euros. So we saved 1 million euros just on refurbishment. In 2022, we delivered assistive products to over 160,000 different users. We delivered almost 500,000 different products to a value of 30 million euros. But the refurbished products made up a total of 90 million euros. So we saved 30% of this just by refurbishment goods. Next, please. When the product is returned to the Assistive Technology Center from the user, it is cleaned and repaired, and we change spare parts so it looks like a brand new product, and then it is put back into stock together with the other products. Next, please. The value of refurbishment varies between the product groups. It is important to consider cost benefits when deciding which product to refurbish. When the product is returned from the user, the staff at the Assistive Technology Center must take into consideration how much work and how much money they should spend on spare parts and repairs before the product can be reused. Is it cheaper to buy a new one? Is the product outdated? Many products like walkers and manual wheelchairs come at a very low price, But we also have to take environmental issues into consideration. So last year, the Norwegian Assistive Technology Center, we purchased these kind of manual wheelchairs for 11 million euros, and we refurbished wheelchairs for 7 million euros. So almost 40% of the value of wheelchairs given out from the Assistive Technology Center were refurbished ones, so we saved 40%. Next, please. For this powered wheelchair with joystick, we purchased wheelchairs for 26 million euros, and we gave out refurbished products for 6.5 million euros, almost 40%. And my last example, next please. Is this powered wheelchair with a manual control. This is really easy to refurbish and are used over and over again, mainly by elderly people. So you see that we refurbished more products than we actually bought. Over 50% of the refurbished products were given out to the people. Next, please. The opportunity to exchange the assistive products frequently is especially important when working with children. Because of natural causes like growth, the refurbished system makes it possible to see to that the products are well adapted at all times. The products are seldom worn out when returned to the assistive technology center, which makes it easy to reuse for another child. It is very important to provide a product which is well adapted to the child, both in seating and standing positioning, to prevent contractions and deformities. It will also improve the chances of independent mobilization. Since we have the opportunity to exchange the product in short time with no expenses, we don't have to get a product which this child can grow into and have for many years. This is also important working with spinal cord injury or amputees. After the trauma, the user often experiences changes in muscle tone and mass, which requires changes in seat width. To be able to propel the chair independently and to prevent musculoskeletal pain, we seek to adapt the chair, or we must exchange it for another size. Next, please. We have been talking a lot of data, and in Norway we have a national information communication technology system, and for all the registration we use this system. This keeps tracks of all the cost and distribution of assistive products, repairs and other services. It gives us good statistics that we can use in the operation of the Assistive Technology Center and for reports to the Directorate of Labour and Welfare, who runs all the assistive technology centers. We get an overview of all the stocks and products, and therefore the products can be shipped between the assistive technology centers all over the country and reused all over the country. So this means that we can register and ship products all over the country using the same system. If the user moves to another county, we can still see all his registration and follow his history. And this is not often the case in the municipality, the local communities, where the ICT system often varies and doesn't interact. Last, please. So, my key points. The system is free and based on individual rights. We cherish user involvement very much. We have the same level of services all over the country. We have a national procurement agreement with the dealers. We offer repairs and services, including preventive services. And of course, we refurbish and reuse. And the national ICT system gives us good data on both services and products. And we have the education program for our stakeholders and the local authorities. So thank you so much for joining this side event and listening to me. Are there any questions or? Yes?
I'm just wondering, the services are provided, is this where an amputee would go for their prosthesis as well, or is that in another area?
It is another system, but it's also covered by the insurance scheme. That is taken care of by the hospitals. They will apply for the orthosis or prosthesis, and they will go directly to the workshop, to the dealer. So it's another system, and unfortunately we haven't got the same good refurbished system for orthosis. So this is for the assistive technology products, unfortunately. But it will be free, but it's another system. Other question? Okay.
Just a question that maybe you explain, just for example, when the people with disability, they want to get assistive technology products. So how they travel to get the service at the AT center and do the assessment and then waiting to get the products and the process. Just want to know the process, how the people they can get those products. Yes.
It's a good question. We depend on the local authorities. So it always starts in the local authorities. So if you would have a problem at home with your family or with yourself, you will contact the local physiotherapist or occupational therapist who work in your community. And they will go to your home, meet you and have an assessment to find out what you have the need for. And they will find out together with you and your family what solution you would like to apply for. And they will help you to put it in the information in application form, and they will send it to the Assistive Technology Center in the county where you belong to. And they are the legal decision makers. So if they see that the application is fine, you will get an approval. And if you don't need a fitting or things like that, they will just order the product or take a refurbished product out of the shelves, and they will send it to the municipality, and the occupational therapist who has your case, they will bring it to your home and see to it that it is fitted and well adapted and train you in using the equipment. So you don't have to travel to the Assistive Technology Center. That is just in the rare and special cases. If you need a center of excellence, if you need more help, then you can go together with an occupational therapist or physiotherapist to the nearest Assistive Technology Center in your county, and there will be professionals helping you, cooperating with your local therapist, finding the best solution, doing maybe another assessment if the assessment isn't good enough, and they'll do trials out of the products, do fittings and adaptation, and then they will find the best solution for you. And then we will send out the product to the municipality, and they will do the follow-up at your home.
Yes, and how long that the people they waiting to get the products is average?
The waiting time?
Yeah, waiting time.
It depends from county to county how big the population is in each county, but it will be some weeks, maybe 3 to 4 weeks. So it says that the application form should be be approved within 3 weeks. Then you should have approval or yes or no on the application, and then it depends on how rare and complicated your case is. If you just need a walker, then it will be a very easy application, and it will maybe be handled in a couple of days, and we will just send the product out, take it from the shelf and send it out. and then you get it in some days or some weeks. If you are applying for a rare, complicated solution, maybe with fittings, maybe we have to buy some services from the dealer, do an adaptation or something like that, it will, of course, take a longer time. So it depends on the solution.
Maybe one more question related to the professional staff. You said that the local authority, they will do the assessment, right? And then so they are like the physiotherapists, they are occupational therapists among the local authority team, right? Okay. So, okay, thanks.
And it depends on the solution. This is for mobility. If you have a vision or hearing impairment, or maybe a cognitive impairment, it will maybe be the teacher in school or some other professionals helping you in the municipality.
I apologize if this is something you covered at the beginning. I came in a little bit late. I'm curious about somebody who's had an accident in hospital and needs a mobility device, you know, on discharge, how that happens vis-a-vis the center and getting it afterwards. Thanks.
Yes, if you have a trauma, the application form is often filled out in the hospital. So the physiotherapist or the occupational therapist at hospital will start with the application forms. And if you, for instance, have a severe injury from a car accident, maybe we will see to that the dealer visit the hospital and start the process at the hospital, because we know that you will be having a permanent injury, so that you are approved for a wheelchair, so that we will start the process in the hospital. And sometimes the hospital have some equipment that you can lend while you're in the hospital. And if you need something for a short time, the municipality are supposed to cover that. But if you have a severe injury, we usually work together with the dealers. So we start the process early, so that we try to get the equipment ready as you go home to start the rehabilitation process.
Can I ask a follow-up question? Sorry. And does that include, you know, so for somebody who's had a serious injury, they're in hospital, and they will also require home adaptations. Does that also include, you know, home assessments and things like that, and addressing those kind of issues? Thanks.
Yes, and often we let the local therapist take care of that, because it's difficult to have the occupational therapist or therapist in the hospital saying something about your home. So often you will go home, and the local occupational therapist will do a home visit, and then we see all the alteration you will be needing. Do we change the environment? Do you need some equipment, some lifts or ramps or things like that to ease the accessibility of your home environment? So that will often be taken care of by the local professionals in your home.
Okay, good afternoon. My name is Vivot. I come from Access Program, the Australian bilateral program supporting Cambodia, including disability inclusion and rehabilitation. My apology, I missed the room. I went to the ballroom one. If my question a little bit outside your presentation, please accept my apology for that. I understood Norway has been very progressing and also has been supporting Cambodian team, especially in collaboration with Person with Disability Foundation, to train there in the area like spinal cord injury and like that. Just to clarify, is it what that you has been provided sit under the social welfare? And what is the connection with the, I'm asking the question, sorry if I'm wrong on that, because we are in the transition, as you heard from our colleague on the discussion from Mark from ICRC. So Cambodia in the transition of physical rehabilitation from social welfare to MOH. if the case that you sit under social affair, we would like to learn from you what could be your advice. But if I miss this point, that is not the case. My question is about the specific on the spinal cord injury. We found the spinal cord injury after discharge from hospital. Without proper support, the quality of life and the life long is very, very, very short, okay? So what is your experience in this area in supporting the quality of life of people in the community? I know that Cambodia and your country, the economic situation is not the same, but it's good also to learn from that. Thank you.
I'm not sure if... Yes, yes. Yes. We have two ministries. The Ministry of Health is taking care of rehabilitation, all the hospitals, so all the doctors. And what's special about Norway is that the Assistive Technology Centers is under the Labor and Welfare Department. So it's a different ministry. So we try to cooperate, but of course, as you were talking about silos, it's difficult. But we have the other welfare benefits in the same system, under the same ministry, so it belongs to the other welfare benefits systems. For instance, labor benefit and things like that. Norway, we work with all impairments. So of course a spinal cord injury would be a permanent impairment. So we have the right by law to have the assistive products and the assistive technology that you need to live an independent life. So we therefore provide assistive technology for your home and for workplace and for children, youth under 26. We also present products for leisure time and sports. So we doesn't divide between spinal cord injury or if you have impairment from birth. It's the same system and it's the same right by law. So I'm not sure if that answers your question, but yes, so you are entitled to the same products and the same assistive technology if you have a trauma or if you have something from birth. Any last questions for me, or we pass on to Kylie? Thank you so much for your attention.
Thanks. Thank you. Well done. Thank you. I'll just stick this here so I can keep track of the time. I want to say that, you know, I have had the opportunity to visit the AT centres once very briefly, and then just recently I brought a group of people, a national task force from Egypt, who are looking at restructuring their whole assistive technology, mostly with a focus on mobility, their services in Egypt. And I think that intersection between the Ministry of Labour and the Ministry of Health is very interesting, but it seems to work very well. I know, Berit, you said, you know, there's a bit of siloism, but we visited the rehab centre, where, you know, many people with amputation or spinal cord injury would be seen, and they would have their in-hospital rehabilitation. But they were immediately beginning work on the assistive technology and liaising with the AT centres, and it seemed pretty seamless to me. But the health intervention aspect comes under health. The AT centre manages the product procurement and provision, but most of the staff come under health. Apart from the AT centre staff, they're under the Ministry of Labour, but the staff in the municipalities that Berit was talking about, they're all under health. So, you know, it works, and I would say that for the clients, it's relatively seamless. So they don't see these distinctions as well. Would that be fair? Okay. So can I please ask for the other presentation to come up? Thank you. Now, what we have... Oh, we actually only have 10 minutes left of our session. So let's bring the slides up. I was going to go through a quick overview of WHO. I'm going to skip that. So can you progress the slides a little bit, please? Yeah, so we go forward and, yeah, forwards, forwards again. Keep going. I think we'll skip this one. If anyone wants to know about WHO, let me know. We're just going to keep moving. Next slide. Next slide. Next slide. And here we are, the WHO Access to Assistive Technology program. It's very awkward when you haven't got the slides in front of you. You don't know what's coming next. So next slide, please. So what I would like to do is just talk to you very briefly about my team. So I'm, in case you didn't pick it up yesterday, I'm meeting again at 30:30. Yes, I know, but people need their cups of tea. I think that this is important. So I need a cup of tea. So I'm Kylie Shea. I'm the team lead for the Access to Assistive Technology team at WHO. And I'm based in the headquarters. I have a small team of technical officers that work with me to help drive forward increased access to assistive technology. Some of you may have met, I hope, Chapal Kashnabis, who, yes, so he was my predecessor in the role. So if you want to position me at WHO, I have stepped into Chapal's role when he retired at the beginning of this year. Now, to give you a bit of a sense of where we sit, because it is a little bit confusing sometimes, at WHO we have a team that focus on rehabilitation, and within the rehab team we have specialists in vision and hearing care, and they also are involved in assistive technology for vision and hearing. And of course, within rehabilitation, there is an intersection with assistive technology. And those teams sit in another division in WHO. We're huge. There's about 4,000 staff at headquarters. So sometimes people say to me, do you know so-and-so at WHO? Yeah, no, sorry, because there's many people. But in terms of the rehab, the vision and the hearing team, we work very closely together. But assistive technology sits over in the division of medicines and health products, because at WHO we see assistive technology as one of the 4th health products. There is medicines, vaccines, medical devices, and assistive technology. And we see that ministries of health, which are the natural counterpart to WHO, ministries of health hold the leadership and the responsibility to ensure access to assistive technology as one of the 4 health products. And our role is to support ministries of health at their request to achieve this. Next slide, please. So here we are. There we go. We're responsible for supporting countries to build equitable access, and we use this 5P framework that was introduced yesterday. Next slide, please. The other thing that sometimes people get a bit confused about, if you've heard of the GATE initiative. Now, the WHO Access to Assistive Technology team, with many individuals around the world, have initiated the GATE initiative. And all that means is it's a community of individuals who really care about increasing access to AT. And as you are here in this room, I would suggest that you also really care about this issue. And if you are not already a member of the GATE community, please become one. And I have cards over here where you can easily grab the QR code and become a member. It's individual. You don't have to be an organisation or anything like that. You just join, and then you will be given updates on some of the work I'm about to share with you. Next slide, please. Okay, we talked about this yesterday. Assistive technology is really diverse. Here in this context, there's a big focus on prosthetics and orthotics and wheelchairs and walking aids, and so there should be. But if we're thinking about system strengthening, we need to think more broadly, particularly because of those demographic shifts that I talked about yesterday and the changing world that we live within. Next slide, please. I've talked about this already. This is what assistive products are, one of 4 health products, and it's needed within health systems at all aspects of health care. You know, many of you, I am sure, will be very aware in your countries there is an increase in non-communicable diseases. It's a global issue. And there is a role for assistive technology in the prevention of complications such as diabetic foot wound. If we can catch risk of a foot wound early, we can use assistive technology to prevent that wound from becoming worse, or the risk even. We can lower the risk of there actually becoming a foot wound by using preventative assistive technology. That's just one example. So assistive technology plays a role within the whole health spectrum. Next slide, please. I also like to show this slide just quickly in that, you know, don't forget when we talk about assistive technology, there are 6 streams. And listening to the conversations this morning around mental health and, you know, the stresses that people suffer as a result of landmine, I was going to say landmine attack, but that isn't right. But, you know, landmine survivors. Assistive technology can actually play a role in supporting people in terms of their mental health as well. So please feel free to talk to me about that. But it's relevant across all of these human functions. Next slide, please. I'm going to skip over this one. The reason it's up here is when I'm giving this kind of presentation, I do like to emphasize that the Global Report on Assistive Technology is your tool, which is why those of you that got here earlier, I gave you a copy. There's more copies over here. I don't want to take any back to Geneva with me, so please get more from the table and take them with you and spread them, because these are an advocacy tool. You go back to your countries and you want to really emphasize why it's important for there to be action on increasing access to assistive technology. Use the global report, use the statistics that are there, use the recommendations in order to build political will for change. Next slide, please. All right, I'm going to rapidly whip through some of the tools that we have to support member states. That's our job at headquarters. We do 2 things. We develop tools and resources, and we try to do that so that they are in step with what will help you in your countries. And we also try not to do too many tools, so we try and integrate tools into one so as not to confuse our countries with too many documents, etc. And the other thing that we do is we do provide technical support, and we do that through our country offices. So, you know, if you come to me and say, can you please help me with my AT centre or with my rehab centre, it will be, have you spoken to the country office? So we will always work through our country offices. I'm going to go through these tools so that you are aware of them if you were not. And over here, the card where you can join GATE also has QR codes to our website and QR codes to some of these tools, so you can find your way back to them. They're all on the internet. So the first thing to mention is we have a toolkit for data. So this is for being able to measure the situation in countries. We have a survey which can be rolled out in countries. It's been used in over 40 countries globally, and it gives us the opportunity to understand from the population what they see individually as their need for assistive technology and whether that need has been met or not. And it's called the RATA. It's a global survey. It's a door-to-door household survey. We also have the ATA-C, which is the Assistive Technology Situation Assessment, and that is a country assessment, and that involves having someone in the country take the leadership role and to consult with all of the stakeholders to really map what is the capacity in a country to support access to assistive technology. And usually that process ends in a national consensus workshop. Everyone comes together, they validate the findings, and together they work out the priorities for action. And often is very helpful if you already have a RATA and you have that statistical data, because then you can bring it all together to say, this is where we want to start. We also have progress indicators, and you would all play a role. If you are not in government yourselves, you can play a role in encouraging the governments to respond to the progress indicators. We have 10 indicators that we ask governments to answer and tell us where they are at in terms of legislation, service delivery, personnel training, policy frameworks, and so on, for the support of access to assistive technology. We've run it once, and that data fed the global report, and we will run it again in 2025 in order to report to the World Health Assembly on progress. And last time we ran it, 70 member states answered. This time round, I'd like to see 140 member states responding, and it would be amazing if every 4 years we have as many countries as possible responding to those indicators. There's one other tool which is in development, which is the ATA-I. So it's the AT Impact Assessment. And we're hoping to pilot, we will definitely pilot that next year, probably in Sri Lanka, a couple of other countries, possibly as part of the RATA. And that is all about the impact that assistive technology has had on an individual. And it's a short question survey. Next slide, please. So that's the ATA toolkit. I'm going to flip through these. It's in the global report. So the statistics I presented yesterday. Next slide, please. These are just key findings coming up now. Inequity, no surprise. 90% of people surveyed in higher income countries had access to the assistive technology they need, and as few as 3% in some low income countries had access. It's a global inequity. Next slide, please. We know that actually the biggest group of service users of assistive technology are older people, 2 out of 3. Across the whole population and all ages, 1 out of 3 people need AT. But when you get 60 and above, 2 out of 3. We have to think about it. Next slide, please. We also know that despite the world moving towards universal health coverage, and that being an important goal for many countries, 67% of people surveyed for the global report have to pay for their assistive technology out of pocket. And that is not the principles of universal health coverage. Next slide, please. And we know that the barriers are high cost, lack of support, and low availability. Next slide, please. And we know that the need increases during emergencies. Next slide, please. Okay, this is this systems data. So this is what we got back from the 70 countries that provided input on the progress indicators. So those 10 indicators. And what it tells us, this funny looking web thing over here, essentially the fact that this side is less purple is telling you that the weakness in those 70 member states is in provision and personnel, which is kind of good in a way because we can actually do a lot to redevelop the systems to make the provision services more accessible, and we can do a lot around training personnel. It's a little harder to increase the number of the workforce, but we certainly can think about strategies to make better use of the workforce. Next slide, please. Okay. Yes. The yellow part, it's showing partial coverage. So if you can see here, so you got a little bit, but it's really, this one is yes, full coverage, and so you can see, yeah. Next slide, please. Okay, so I'm going to, again, whip through. This is what, this is still a key message. And again, I think I spoke about this enough yesterday, that really what we see as a solution, and this is in the global report as a recommendation, is to really integrate access to AT all the way through to primary health. And I think what Norway is doing is an exemplary model of how that can be done. Next slide, please. These are the 10 recommendations, and I'm absolutely not, and I never do, go through these when I'm presenting, because again, you've got them in the global report. And there is plenty in here for everyone. It's one of the things that I do like to say is that you can pick up these recommendations and think, well, what's my role? And where can I act in this? Next slide, please. Okay, so again, very quickly, what is WHO is doing? How am I for time? I'm sure I've gone past 19. Can you give me just another 3 minutes and then it'll be a really fast cup of tea? It's okay? I'm sorry. Next slide, please. Okay, so we don't have to do this one. I've done it already. Other than to say that having data helps you in policy. You need the data to inform the policy. Next slide, please, which is why we put money into that. Okay, in terms of our products, I think it's really helpful for people to be aware. If you are not, actually, can I just have a show of hands? Who already knows that WHO launched in 2016 the first ever priority assistive products list? Oh my goodness. I'm very glad I'm telling you then. In 2016, for the first time ever, WHO launched a priority assistive products list. It has 50 products on it. It was developed through a consensus process, and it stands alongside WHO's essential medicines list and our essential medical devices lists. And so this is a powerful tool for ministries of health to be aware of, that a whole group of people and WHO have endorsed this as being as important as having the essential medicines. Now, we are developing this list further, and by the end of 2024 it will be updated, and we will also be putting it on an online platform to make it easier for some people to access. Online isn't always easier, but it will be online and easier to search. So that's a heads up. And then to support the priority list, we developed specifications for 26 of the products. So if you're trying to procure in a country, there are detailed product specifications that can assist. You can also come to our team if you would like support on procurement through the country office. Next slide, please. We also do work around supporting countries in provision. So we have developed standards for prosthetics and orthotics, and I think many of the stakeholders at this conference who are involved in provision of prosthetics and orthotics would be well aware. But last year we launched an assessment tool which will enable services to assess how well they are measuring up to these standards. And I have given Vivath a copy. I think Mark from here from Cambodia is very keen to have a copy. I have one more copy of those standards. So if you are running a prosthetics orthotics service and would like to take, not the standards, I have the assessment package, please come and take it. That would be great. And if you need more, it's online. We also launched wheelchair provision guidelines in May 2023, and I have a few copies of those over here. So please, if you're actively involved in wheelchair provision services in your country, take them. And of course, they are online as well. And they give high-level guidance about the minimum that should be in place for adequate wheelchair provision services. And then heads up, in 2024, we will begin work on guidelines on the provision of assistive technology. And many people will hear more about that as we move forwards with that project. Oh my goodness, we need to go. Right, next slide, please. I think I'm gonna, right, TAP, training in assistive products. This is another tool which is designed to help build community health personnel, primary health personnel's competence to provide simple assistive products. It's an online tool. And again, if you're interested, the QR code is over there. Please feel free to talk to me. I will be here this afternoon and tomorrow, of course. Next slide. I think that's about it. Our work in emergencies. Yesterday it was mentioned that there was the provision of assistive products with support from WHO into Ukraine. I want to flag, Ukraine is not the only country where we've been responding in this way. Since I joined the team in February last year, we have had active responses in Ukraine, Syria, Sudan, Morocco, Ethiopia. We're now looking at supporting Armenia. And of course, there's a really big situation in the Middle East you will all be very aware of, and we are on standby to support there when it's clearer what we can do. I think that's the end of my slides. Let's hope. Next slide, please. Just flick through. So, yes, that's it. There's all the there. That is the rapid overview of WHO and our assistive technology team's work. Very happy to talk to anyone that has any further questions, but I'm going to close it there because I have a feeling we need to move. There's another session, and please get a cup of tea before 3:30 if you can. Thank you very, very much.